Okay. Hi, Summer. My name's Jenna. I'm going to be the nurse practitioner that's going to be seeing you today. So what brings you in for the telehealth visit today?
Hi. Well, I've just been feeling burned out from work and not sleeping well at night. Like I wake up a lot at
Okay.
night, like every hour sometimes.
All right. And what are your vitals for today's visit?
Um, Blood pressure 149 over 80 and heart rate 77. Um, Temperature 97.4 and respirations 18.
Okay, good. So when did you notice like the irritability and the trouble sleeping? How long has that been going on for?
Um, like the last month or so, like I've just kind of been like my temper is set off like a lot easier, faster. And I don't know if it's because I'm just burned out from work, from working 90 hours a week. Um, so for about the last month.
Okay. And are these like problems happening all the time or pretty much just when you know you have to work or while you're at work?
Lately it's been all the time.
Okay. Does it get better like if you do anything, does it help or is it kind of just steady? Nothing seems to help, nothing seems to make it worse.
No, like the medication that I'm on used to help kind of take the edge off, but I don't know if it's just not working anymore.
Okay.
When I know I don't have to work for a while, like for a few days, that kind of helps. But lately, I just am irritable all the time.
Okay. And where are you working? What kind of job do you have?
I am working at, I'm working as an accountant.
Okay. And you said you're working like 90 hours a week.
Yeah,
So pretty heavy schedule.
yeah.
Um, do you have any health history?
I do have some, yeah, I do have some mental health history. I was hospitalized, like in 2012, 2013, and I did go through some treatment at that time. And that did help,
Okay.
but
And like the diagnosis, was it anxiety, depression, something else, both?
both.
Okay. So you do have a previous diagnosis of anxiety and a previous diagnosis of depression.
Mhm. Yeah.
Okay. And you said you were previously hospitalized for psychiatric treatment. Any other hospitalizations or surgeries?
No. Mm-mm.
Okay. And then are you currently on medication for these things?
Yeah. Right now I take Paxil, Klonopin, and Ambien.
Okay. And is the Klonopin just as needed?
Yeah. Yeah,
Okay.
but I've been taking it more lately.
Okay. So are you taking it every day? Or are you taking it multiple times a day? How have you been taking it lately?
I just take it at night, like to help me sleep, but it's not helping, and I'm afraid to take more because I don't want to cause
Okay.
any problems.
Good. Do you have any allergies to anything?
I do not.
Okay, good. And looking at the sleep problem, how many hours of sleep would you say you're getting a night if you had to just guess?
I probably get up like every hour to 2 hours. So I
Not.
mean, probably like 4 hours total, but yeah,
And are you having trouble falling asleep and staying asleep, or is it more so just like you fall asleep and then you're waking up constantly?
I fall asleep and wake up constantly. The
Okay.
Klonopin helps me get to sleep, but then I'm waking up a lot. And the
Okay.
Ambien, I don't think, is doing anything for me anymore.
Okay. How long have you been on the Ambien? A while since.
Yeah.
Okay.
Hmm.
Um, have you been hearing things or seeing things that aren't actually there?
No. Mm-mm.
Any thoughts of harming yourself or anybody else?
Nope.
Good. And who do you live at home with?
My husband and my son.
Okay. And do you feel like your family's supportive when you're
Yeah.
going through hard times like this? Good.
Hmm.
Do you smoke cigarettes?
I do. Yeah, half a pack a day.
Okay. And what about alcohol or drug use?
No, just social,
Okay,
like drinks socially, no drug use.
good. Um, any vision changes, eye pain, discharge sensitivity to light, problems with your
No,
vision?
I wear glasses but no, I don't have any issues.
Okay. Um, sore throat, nosebleeds, nasal congestion, problem swallowing,
Nope,
any problems with hearing?
nope. Mm-mm. Oh, no.
Okay. What about headaches, dizziness, tremors, fatigue, fevers?
I do get a lot of headaches, but that's it. I think that's just from not sleeping well. But yeah, nothing else though.
Any chest pain? Feel like your heart's beating really fast?
No, I do have hypertension.
Okay.
So, but I don't check my blood pressure at home, so I'm sure that's probably high. Well, I guess it wasn't today, but I don't know. I'm not getting much sleep, so I don't know if that's affecting my blood pressure or
Being a
not.
little bit irritable and stuff too can also increase that. So, um, any shortness of breath, coughing, wheezing,
Nope.
okay, and then bowel habits, constipation, diarrhea, any problems there?
Oh, I do have the IBS, so yeah, I have diarrhea every day.
Okay, and do you see a GI doctor?
No.
Okay, not a bad idea to just check in. Make I can make a referral even for a GI doctor just to get checked in, since it's been a while.
Okay.
Any vomiting, abdominal pain, changes in appetite?
Nope.
Okay. Any joint or bone pain?
Um, I do get some joint pain, but that's about it. I don't know if that's just from not sleeping well.
Right, which it can all contribute to that. Yeah. Um, any rashes, skin irritation, anything that you've noticed?
Nope.
Okay, good. So main concerns today are one, sleeping. You're not getting quality sleep. Also, just kind of anxiety surrounding having to work and how much you're working and just the job itself. And because of the combination of those two, it seems like you've kind of been irritable, kind of snapping at maybe your family members or people you work with.
Mhm.
So, anything else, any other problems you have going on that you can think of or forgot to mention earlier? Or is that pretty much?
Um, I did take that PHQ test
Mm-hmm,
last time, or like I mean, it was this year.
mm-hmm.
So I don't know if I should redo that or not,
Oh,
but
it's probably not a bad idea. Do you see a psychiatrist, like a counselor?
uh, yeah, I do.
Okay, and how often are you seeing them?
Not consistently because I work a lot, but we do like video visits whenever we can, maybe like once a month,
Okay.
once every
Um,
other month. I should probably do more, but I don't really have time.
I understand. Probably not a bad idea to follow up with her since you seem to be having increase in symptoms from the anxiety and the insomnia and stuff like that. So not a bad idea to follow up with your psychiatrist, see what she has to say. Counseling is very helpful. So I would recommend following up with her as well. Um, and then for the PHQ-9, we can send you one, I believe, over like through your email or something like that, and then you can fill it out and email it
Okay.
back to us just so we can have a
Okay.
baseline. So we can plan on doing
Okay.
that as well, and then we can review that at another time, or you can even do it through your psychologist or psychiatrist, whoever you're seeing. They might be able to also do
Okay.
it too. So we can go from there and
Oh, that's right. I did go with them last time, so I'll ask them again. You're right.
okay,
I did. Okay.
perfect.
I'll ask my therapist. Yeah.
Perfect. So today I think majorly what's going on is you're having kind of like an exacerbation of your anxiety disorder, which is that generalized anxiety disorder that seems like you've been dealing with for quite a while. It's been under control, but just having an increase in those symptoms. So I think we'll have to review those medications, maybe change a little bit, change some medications and see if we need to go up on anything, change anything completely, to get better control of these symptoms. Also, it seems like your insomnia, not being able to sleep and stuff has kind of been getting worse. Medications aren't working. So um, I'll probably want to change something with your sleep medication as well. So
Okay.
my plan is I was thinking about increasing your Paxil to 20 milligrams daily because you were taking 10
Yeah.
milligrams, is
Okay.
what we have on record. So 20 milligrams is actually the recommended dose to treat generalized anxiety disorder. So I think we should
Oh,
do that. And it can take, I know you're probably familiar with it, but it can take 4 to 6 weeks to fully work. So unfortunately, you just got to give this medication some time to, kick in and see if you see a difference then.
okay.
Just to go over some of the side effects of that medication and increasing the dose. Side effects include nausea, drowsiness, dizziness, loss of appetite, dry mouth, blurred vision. So if you do start to experience any of those, just go ahead and give us a call at the office and we can discuss like alternate treatments. And
Okay.
then, so hopefully that will help with the anxiety aspect of what's bringing you in today. And then for the sleep problem, I want to try switching you from Ambien to a medication called Quivevik to help with
Okay.
insomnia. So with Ambien, we have to wean off the Ambien because you can get some withdrawal symptoms from it.
Oh, okay.
So what I want you to do for the Ambien is I want you to start taking it. You said it's not really helping you anyways, but I want you to start taking it every other night for a week.
Okay. Okay.
For 1 week, you'll take it every other night. And then the following week, I'll just have you take it 2 times that week, kind of like 3 days apart or 4 days apart, and kind of wean you
Okay.
off that way so that way we're not just stopping it. And hopefully we'll avoid any withdrawal symptoms.
Okay.
And so after those 2 weeks are finished, then you can start the Quivevik. So signs of
Okay.
withdrawal from the Ambien, just so you're familiar, are nausea, vomiting, cramps, shakiness. So just keep an eye out for those symptoms. Give me a call if you do have any problems with that, and we can figure out something else to another way to wean you from it. Um,
Okay.
so a little bit about the Quivevik. It's still a controlled substance, but it does have less chance of misuse and dependence than Ambien, which is nice. You're going
Oh,
to take it pretty much the same way. You're going to take it 30 minutes before bedtime. And then you're only going to take it if you have 7 hours where you can sleep or rest. Like you can't take it if you have to get up in 3 hours to do something just because of the drowsiness
oh,
effects. So make sure
okay.
that you're taking it 30 minutes before bedtime. And then you have at least 7 hours where you are going to be sleeping or at least be in bed and kind of not doing anything for those 7 hours.
Okay.
Some side effects of the Quivevik include decreased awareness or alertness. Your ability to drive and think clearly might be a little bit altered, which is another reason we don't want you taking it if you have to do something too close to when you took your dose.
Okay.
Don't take more than prescribed. Don't drink alcohol while you're taking it. And then
Okay.
don't drive or operate heavy machinery if you don't feel fully awake or it hasn't been that full 7 hours since your last dose. Um,
Okay.
so the most common side effect with this medication is sleepiness and headache. So just keep an eye out for those things. Once again, just call me if you have any problems with that. Um,
Okay.
and it is still a controlled substance, so we'll still have to do those ORS reports that you had to do with the Ambien. So that won't change, but it does have that less risk of dependence, which is really nice. Um, and then any other questions or concerns for this visit? Are you okay with the treatment plan and the changes in it? Do you feel comfortable with that? Or do you have any questions about
Yeah.
how you should be taking these new medications? Or
No,
just,
that all sounds good. Can I still take my Klonopin as needed, or should I
yep.
hold off on that for,
You
okay.
can still take your Klonopin as needed, especially if it's helping you sleep at night. I would, once
Okay.
you start the Quivevik, I would maybe try to back off the Klonopin so that way we can see if the
Oh,
Quivevik's helping you fall asleep instead of the
okay.
Klonopin. So I think
That
as
makes-
long as you're taking the Ambien still, you can continue with the Klonopin since that's what you have been doing and it's at least getting you to sleep. Um,
Okay.
but once you start the Quivevik, I would try and give it a good week or two to see if that's helping you fall asleep without the Klonopin.
Okay.
Okay. And then follow-up appointment. I would follow up with your psych, maybe get in like as soon as you could, 2 weeks, just because they
Okay.
know a little bit more with your history and stuff. They might be able to, discuss some things with you in therapy, help get you through this hard time. And then I'll have you follow up with us in a month. So you can make an appointment with us. You can just call the office and we'll do a follow up in a month to see how those medications are working. Since it does take a couple weeks and you won't even be starting the Quivevik for probably another 2 weeks. So we'll give it a month and see how you're doing then. Obviously call if you're having any side effects, anything concerning, or have any questions for us. You could always call the office. So we'll plan for all those changes and we'll follow up in a month.
Okay, yeah, that all sounds really good.
Perfect. Any other questions?
No,
All right. Well, thanks for coming in today and we'll see you at your visit in a month.
okay, thanks for your help.
All right. Bye.